Okay, and welcome back to another Mathur Dental Education Weekend Wisdom. I hope everyone's had a great couple of weeks here. Where I am in Canada, we were having a pretty dismal snowstorm for a couple of weeks, and now the wonderful Chinook has come over the mountains, and we have some beautiful weather, and hopefully this lasts for a long, long time. I want to apologize. I know it's a little bit later this time. I have been pretty busy with my team as we're setting up a new practice. So it's pretty exciting on my end as well. And we're getting ready to set up a new practice in the next couple of months. And we're doing all the planning. And it's all the same emotions, whether it's your first time or your fifth time. It's exciting and it's nerve wracking and stressful and wonderful all at the same time. So I apologize also if I'm speaking a little bit quieter than usual. The kids are in bed and I am trying not to wake them up. If we get interrupted, I apologize, but I think we're okay. This week, I want to tackle the question of, do I have what it takes to run a successful practice? So an email I received. Hi, Dr. Mathur. Thank you for your informative web videos. You're most welcome. My question is less technical. I'm wondering if I have what it takes to run a practice successfully. I'm not the most confident person in the world, but I have overcome a lot of self esteem concerns throughout my life. I've always felt comfortable studying and solving academic obstacles. I've always been a studier and feel more comfortable solving dental problems rather than talking to the person that the tooth was attached to. As an associate, I've been able to rely on a very personable assistant to help me connect with the patient. I truly want the best for my patients, and I hope that this comes across. I've been able to answer patient questions and communicate their dental needs sufficiently. I was never a leader. I did not play sports growing up, and I worry that I'll have a difficult time communicating and being strong enough to lead a practice. Should someone like me open a practice? Great question. And thanks again for your email. And to everyone else out there, please keep the emails coming. I hope to be able to either address you individually and maybe, with your permission, address it in one of the weekend wisdoms. So, to the answer to your question, yes. One thing that popped out of your email was the part that you truly wanted the best for your patients. As a fellow member of the same occupation as you, dentists that care about their patients is good for all of us. We all benefit when dentists act with professionalism and integrity. Practice owners that care about their patients' best interests lift up the entire occupation. However, I think what you're really asking is, can I be successful even if I doubt that I have the confidence, leadership, or communication skills required? But still, the answer is yes. These are the skills that can be worked on and fine tuned. These attributes are important, but most importantly, it's important that you obtain the business knowledge required to be successful. There's just some business laws that you can follow to help you become successful. But rather than looking at yourself as needing to be a completed product in order to open a practice, perhaps you should be looking at yourself as more of a work in progress. The best dentists that I know never stop learning and trying to improve. As dentists, we often focus on the clinical skills required to do our job well, but the teeth that we work on are attached to people. If you're already working successfully as an associate, then you've already taken some major steps. When you set up your office, make sure you're stocking up on the skills that you feel that you need to replace within yourself. So have admin and clinical staff that are tremendous communicators if you feel that you're not a good communicator. As soon as you leave the room, the patient will ask about you and they'll vouch for you, as long as you're vouchable. Let's remember what communication allows us to do, and that's to build trust. So how can we build trust if we're not great talkers? Well, let's go through a few. Transparency. You want to be transparent as a dentist, and you're probably, you know, as an associate, this works. This is a good list to look at. So if you find that you're an associate and you're thinking of owning, but you're not having much success as an associate, here's a good place to start. Transparency. You want to be transparent about costs, about expectations of discomfort to the patient, about treatment outcomes. You've probably all heard the saying, under promise and overproduce. You want to be transparent, and that's how you build trust. If you can deliver, and if what you say is going to happen is what happens, patients will. That's one way, without talking or without having to be a great orator, patients can build trust in you. Listen actively. Pay attention to the patient's concerns and provide clues that you've heard and care about them. What I mean by clues is that when you're discussing things back to them, highlight the aspects of the treatment options that correlate directly with what they were discussing as perhaps a concern. That shows that you're listening and you're taking them seriously, and that they'll start to trust you more. Of course, have a positive chairside manner, be friendly, respectful, and show empathy. And then just demonstrate your expertise. If you're able to solve a patient's problem to get them out of pain, that often can be more valuable than any form of communication. Dentists that are listening to this out there know that a person's life can be put on hold with a bad enough toothache. I've shown up to a practice at 8 o'clock in the morning and had a patient waiting out there, and they looked like they had been there for a while. Their toothache was so bad in the middle of the night, they went into the garage and grabbed some pliers and ripped out the tooth, except they only got half of it. As soon as I was able to get that tooth out for them, their shoulders slumped, and I promise you they probably went home and slept for 14 hours. But they were so happy. That wasn't about me becoming across as a leader. That's me solving their problem. And that's why they returned. Have your office encourage satisfied patients to refer people that they know. Another way to build trust. Make sure your online reputation is positive, and just respond to reviews. More to the list. Honesty, integrity. Yeah. Be upfront about limitations and when to refer patients to specialists. Stand by your work. Have a comfortable office environment. So you want to maintain a clean environment, but also, are staff stressed and running around? Are they happy? These aspects can often say more about you than you ever could say about yourself. Leadership. You mentioned, I never played sports growing up. In your email, you mentioned a concern about whether you have what it takes to lead your team. So let's start from the beginning. What is leadership? Leadership is a set of mindsets and behaviors that align people in a collective direction, enables them to work together and accomplish shared goals, and helps them adjust to changing environments. We often talk about the strong and famous leaders that we all know: Abraham Lincoln, Margaret Thatcher, Kobe Bryant. But everyday people are able to galvanize and direct people towards common goals. So, what type of leader can you be? So, the Center for Creative Leadership, they talk about what good leadership looks like. Based upon our decades of research and experience working with leaders at thousands of organizations around the world, we found that the best leaders consistently possess certain fundamental qualities and skills. And here are the 12 traits. Let's go through them. Self-awareness, respect, compassion, vision, communication, learning agility, collaboration, influence, integrity, courage, gratitude, and resilience. You'll notice that of these 12, only one is communication. So self-awareness, how I interpret self-awareness, and this might be different than the Center for Creative Leadership, is to understand and have the awareness of who you are in the situation when you're dealing with a patient. They're looking for you to provide solutions for what their problems are. They're looking for you to be someone of competence, and they're looking for you to be someone of trust. We talked about trust. So I understand. I don't think in that situation we had those famous people up there. Margaret Thatcher, Kobe, definitely that type of leadership that a lot of us think about, that strong, in charge leadership. But you sometimes have that strength just by being in the position you are as the doctor or the dentist in that situation. So sometimes it's showing empathy. Um, Having some self-awareness in that position understands that the position that you're in and how you'll use that position to help them solve their problem. Respect. I think a lot of leadership can be shown by respect. It can be respect that you're showing your staff members in front of your patients, and respect that you're showing your patients. And when we're talking about leadership here, we're talking about not just leadership to patients, but leaderships for your team. You know, Respect, being respectful to your staff members. Sometimes people think, well, I need to come in there, I need to take charge, and they just see me as the boss. A lot of people working in dentistry have had bad situations. Assistants, hygienists, sometimes they've been in situations where they've felt they've been bossed around too much. A quiet dentist, an unassuming dentist that treats everyone respectfully and cares for their team, you'll be surprised how some people will find that a breath of fresh air and will galvanize people. And that goes the same for compassion. If you've got a staff member who's going through a hard time and you show compassion, maybe a couple of days off, or showing that you genuinely care, that might be new for a lot of people. This is a unique industry with a lot of different personalities. People are coming from maybe not the most healthiest environments. Compassion can help get people on your side. I'm not saying do this strategically, but if you have these qualities, you'll find that people will follow you. Vision. This is going to be really important if you're starting a new practice, but it's really important all the time as a practice leader. You want to be able to provide a vision not just for your practice, but for your employees' careers. You also want to provide a vision for your patients. Someone comes in, oftentimes, I'm sure a lot of you have seen this yourself, where patients come in and they're really down on themselves and they feel like they're falling apart just because they're not in a great dental situation. Oftentimes as dentists, we're trying to provide a vision. We're trying to say, hey, this is how we can get from A to B to C. And C is where they want to be, and maybe in some cases didn't know was even possible. Yes, communication is very important. I mean, I don't want to sugarcoat it and say, look, it's not that important if you don't feel like you're a good communicator. My honest answer is if you don't feel like you're a good communicator, work on those skills. Don't hide under a rock from it. It's really important. How can you work on it? Put yourself in some social situations. But I think naturally, starting a practice and the constant communication you're going to have with your staff members, you're going to find that you're going to pick up skills that you never thought possible. Learning agility. This is the ability to learn. I take this as the ability to learn new skills, to be agile and I mean, trust me, if you're working as an associate and you open a new practice, you're going to have to learn about business. You're going to have to learn about budgeting. You're going to have to learn about communication, which we talked about. There's a lot that you're going to have to learn about, but you can do it. And we'll take you through it in the program, that is. Collaboration. Again, we all think of strong leaders who direct people and bark out orders, but a lot of times people appreciate collaboration. Collaboration empowers people, giving people a voice, a say in things. Of course, you will be the final decision maker, but if they truly feel that you are listening to their opinions and taking them under advisement, that's empowering. That makes people feel good, especially a lot of people who are working in assistant situations or working in a dental office. They may have not been taken too seriously throughout their life, depending on their background. And now they're in a situation where a doctor is listening to their opinions and taking them seriously. Wow, that's new for them, and that's really they're gonna like how you listening to them make them feel, and that is leadership. They're gonna follow you, or at least be quite open to following you. Influence, I think that's pretty self-explanatory. Being able to show influence. I don't really mean influence in being able to sell people on things. Yes, that is part of it, but you can influence people by being a positive example. Integrity's huge in a dental practice. If you are the doctor and a hygienist and an assistant see you acting with integrity towards your patients, and you'll know because they'll bring their family members to come see you. If they trust you and they see you treating people with respect, they feel that you're not trying to oversell or trying to slip a lot of extra treatment into their treatment plans, people will believe you to be a person of integrity, and people want to follow people of integrity. Courage, that can mean a lot. I think it's quite courageous to open a new business and to open a new practice. Gratitude. I think that if you are acting thankful, I mean, I personally believe that I am so lucky to be able to get to be a dentist. I'm not trying to be wishy-washy or soft here, but it is a great occupation. And to be able to own a practice is great as well. If you can show some humbleness and gratitude, I think people gravitate towards that and like that style, like that type of personality, and it can help foster some leadership and definitely resilience. I think even if you're working as an associate, you've had to have this. If you're a dental student, you've had to show resilience. I think that whoever is listening to this, already has this in spades. So let's talk about some leadership styles. There's the autocratic, democratic, laissez faire, and transformational. I'm not going to go too deep into these, but I just want to touch base on them. Autocratic. It's also known as the authoritarian leadership. An autocratic leadership style can be summed up by the command, do as you're told. An autocratic leadership direction comes from the top, a singular figure who leads a company or team. An autocratic leader determines strategy, policies, procedures, and the direction of the organization, dictating everything to subordinates. These types of leaders are not focused on collaboration with those in their circle. They're rarely interested in feedback, and they prefer to hold all of the power and be in charge. Now, I'm not here to say which is right and which is not. I guess what I'm trying to say is I want you to be able to look at yourself and see if any of these types of leadership styles seems more like you. Democratic. It's also known as participative leadership. The democratic leadership approach involves gathering input from your subordinates and team members so everyone has a chance to contribute to the decision-making process. These leaders are still the decision makers, but their approach also allows others to feel engaged and have a stake in the final outcome. Democratic leaders excel at sparking creativity among subordinates, and projects are enhanced when positive contributions come from all sides. Laissez faire. Don't let the name deceive you. This leadership is not a who cares approach. Rather, it involves empowering your employees, being hands-off, and trusting them to accomplish the task at hand without constant questions or micromanagement. These leaders leave decisions to their employees while staying available to provide feedback when necessary. And lastly, transformational. Transformational leadership involves developing a grand vision and rallying your employees around it. Under this style, the team is eager to transform and evolve, personally and professionally, in order to achieve the overall goal. To achieve the overall goal. With the organization employees aligned, teams working under a transformational leader are united for the singular cause and willing to commit their effort, time, and energy to the organization, or in our case, dental practice. Hopefully you're learning about these qualities and styles and starting to see a path to having a practice that you could lead successfully. My point of going through all this I'm speaking directly to the person emailing, but really everybody, is that, excuse me, we all think of leadership and communication and running a business as needing to understand business, and that's what we talk about in our program, but also having a specific personality. And I'll tell you that I've seen practices run by people with varying personalities and leadership skills. You may take some qualities from each leadership style and form your overall personality here. In our program, How to Build and Run a Successful Practice, we dig deeper into the mindsets and skill sets that aid you with your practice. While you will find a leadership style that works best for you, the business laws that we outline in the program will help you immensely. So this is the program, How to Start and Run a Dental Practice Successfully, split into 23 modules. These modules kind of go into two parts here. So Prudent Practice Startup will take you from where you may be right now. Is that a thought in your mind that you'd like to start a practice, to a fully built physical practice. And then part two, Flying First Year Success, takes you from that empty practice to the end of your first year, which has been successful. So I hope that sheds some light for some people that have these types of concerns. I do get some emails from people saying, am I cut out for it? And I don't want to push anybody out there, but I do feel that with the number of dentists going down, there's definitely some fear in the water. I think people are seeing the competition, so to speak, the corporates, and thinking, look, this is not for me. I don't have what it takes. And I'm here to help you and to tell you, yes, you can. You do have what it takes. have a great weekend, everybody. Please send me your questions or concerns if you have any, even just some routine questions about opening and starting a practice. This is my passion, clearly. So I'd love to hear from you. If not, everyone, rest up and have a wonderful rest of your weekend. Take care.